through getting your bed all ready and your all of that at the beginning, you would also get your suction machine ready, which is located in the same area as your cart, and there's a sign. And you would bring it into the room. You want to have it close to the foot of the bed, so I generally try and keep it at the end. And then there's a cord back here that's just wound up, and you just want to unwind it and then plug it in. Always into a red outlet if possible. So this unwinds to give you plenty of room. It rolls around. What you need to check on this machine is you need to always make sure that you have a canister that has a filter, and this is another filter. And how it connects to this machine is there's one port here, and it just goes right in there. The portion that's gonna come from the field that you're gonna plug in is gonna go into this part, so that anything you collect comes through here into this filter and then goes into this container. So this is the tubing that the scrub tech will have on their field. If you look at this, it tells you which side goes to where. There's a little hole where there's an adjustment for suction that goes to the sterile field, and the other part that connects into the machine is this section. So they're gonna pass that off to you while it's sterile, and it's gonna connect into here. The other thing they're gonna ask you to do is give them a curette that's the size that they need to use. They're located in this drawer. There's 8s, 10s, 7s, 9s, 12s, and 14s. If this was a bigger loss, then usually over 10 weeks, sometimes the doctor will tell you that they need to do a D&E. In that situation, you would switch to a different canister due to the size of the products of conception, and that would just do the same exact thing. You would remove it the same and put it in the same, and it would again connect up here. You would have this go here. This is a different size tubing, however, and your specimen is going to collect in the inside and the sock instead. So this would be a different tubing, which is all down here together, and bigger curettes. They're 16 and 14. So if you had to do that, that is what you would do. At the end of the procedure, you're all done. The only thing you have to do during the procedure, the doctor will tell you when to turn the machine on. So you would turn the machine on, and it would be connected. It will, I'm gonna see if I can get it up a little bit. It'll go to this section in here that's green when you have good suction. The only thing they might do is ask you to adjust, and sometimes you can just mess with this a little bit to get it to go up to the green area, and then it'll stay in that green area, and that's perfect. When they suck, it'll all of a sudden drop back down. After you're done with the procedure, what you would do if you had done a D&E is take out this inside specimen sack, and it'll go in a container such as this that's on your cart. So you would open this up by pulling this off, take that out and put it in here and send this to pathology. If you're utilizing the other canister that's most commonly used, all you have to do is take this out, place it in there, put a lid on it, and label it. Okay, so you're gonna gather your supplies that you need to get ready for the case. You're gonna get the suction D&C cart that's out in the hallway. And the first thing you're gonna do is get your bed ready. So you're gonna remove the headpiece. And there's just some little clamps down here on the bottom that you unscrew until it's loose. And you take this whole section out, and then you put it at the foot of the bed. And there's a little notches that it fits into. And again, you have a little screw down here to tighten it, and one on each side. So it's right here. Okay, and then You just pull down your sheet to make it fit, to get your bed nice and back in order.
And Nicole, why are we doing this piece?
So we never want any rippled sheets underneath a patient. We always want it to be flat and smooth.
And why did we pull the head of the bed down to the foot of the bed?
We did that so that we're gonna put the stirrups on the bed and we're gonna be dropping that foot down. So we'll want all of those pieces to come off. So now I'm gonna start putting the stirrups on. So you need the clamps. That's the first thing that you need. And then you have to assess which goes which side, so which stirrup. So you want the inside of the stirrup to be the closest to the bed. So this one will go on the right side. So we'll come over to this side. And this is gonna hook into this section of the bed. So always put it on first, and it has these grooves right here that match up. So you go from the top until it easily goes down and you can slide it. Then you hold your stirrup in two spots to make it easier for you to hold and move it. One here and one hand here. And you're gonna put it into this attachment. And it won't go all the way down right now, so you have to unscrew, and it dropped all the way down. Now, to make sure that it's in the right spot, there's a little section that you can line these two up together. It's kind of like the part of the bed that's a circle, and you can see that on the top. So you line these up, and then you can tighten this in. You tighten it all the way until you feel it's tight. And then you're gonna lower it down for when the patient comes into the room. And then we're gonna put our bed back together and just make sure it's all neat like we talked about. We want them to have that smooth surface. And the other stirrup, we like to place underneath the bed so that it's ready for you. So it'll go right there, because you're gonna need to bring your patient in and put them on the bed, so you'll want it underneath and not attached. And you can't put the clamp on yet either, because if not, the bed won't come in. So now we are going to assume that we've already brought the patient in on the stretcher, and the stretcher came in here, and the patient's gonna move themselves over to this part of the bed. While they're moving, the stretcher is going to be here, and you're actually going to be on this side of the bed to ensure that the patient does not fall. So the important part about getting the patient to this part is making sure that you have the patient in the right positioning. So there's a little hole in this bed. You really want them to scoot down to where their bottom is sitting in the hole, and that way they'll be able to fit their legs in and be in a proper position. So we have the patient move over to the bed, and now they're in the right positions. So what we're gonna be doing is, and this would still be underneath them, of course, because we're gonna have their feet laying on here. So now we're gonna put the other stirrup on, just as we did the first one. So again, and this is actually in our way, so if something's in your way, you would just move it. So again, you're gonna go from the top until you feel it go down, and it can slide. And then you're gonna hold the stirrup again here and here for better control. Sorry about that. And then you're gonna go in, and it's again gonna match up with the beam. And you're gonna tighten this all the way down. So that's perfect. So, whenever the patient, they'll be asleep by this point, so you'll want to now put their legs into the stirrups. You'll put each one in, and then close this section all the way around. Do the same with the other. To get them in the proper position, once their legs are up, you're gonna want their inside of their thigh to be soft. So you're gonna wanna really treat them like you're matching the shoulders with the leg. So for instance, this stirrup looks a little bit too far this way to me, so I'm gonna turn it to where it's facing the shoulder. So now it's facing the shoulder. And if you notice, when you have their leg in, to have good control, you can put this against your belly and hold it here to move it up or down. And then it just locks into place. So now that we have that in the right spot, I'm also gonna check this one. This one looks pretty good, but it's a little too high. So I'm gonna again move it down. And it just slides like this until you get it in the spot and then lock it. So after you have them up in the stirrups, you would raise them up at the same time and they would be positioned. Then you would remove the end of the bed. So again, you undo the hook and put this off out of your way. And then you'll remove this section. And off out of your way. And then you would ask your anesthesia provider to please go down at the foot of the bed.